My name is Leslie, and I'm a respiratory therapist for Home Medical / Children's Home Medical, and we are going to be talking about the pulse ox. This is the machine that will show you your patient's heart rate and pulse ox reading, and so we're just going to go over it today. This is the power button, so that's how you turn it on, and then this is your alarm silence button. Those are the two main buttons that you're going to need to know about. To turn it on, you just hit this button here. It will come on with these lights. It will make that beep, just to let you know that it is working correctly. The alarm silence button. This button you will hit if your patient is aggravated or has taken his nasal cannula out, or maybe is mad because you're changing a diaper. You can hit this button and just make it silence. It will silence it for 2 minutes. So just make sure before you walk out of the room you hit this again, and this yellow light will go out. The top number here you're going to have a reading on is going to be your pulse ox reading, and then the bottom number is going to be your heart rate. This does have a battery life, and the battery light will, this is your indicator right here. 4 lights is a full battery, which is typically 3 to 5 hours of usage. And then if it's plugged into a power source, these lights will go off, and there'll be a light over here that comes on. There will be signals on both sides of this here. This one will bounce with your patient's heart rate, and then this one will be your indicator, so whether you have good placement or not. And we want both of them to be green. If there's any red or anything like that, then you don't have a good signal, and you'll need to check your placement. Like I said, this is the pulse ox and heart rate, and that's pretty much all you really need to know about the pulse ox itself. There is, when you first turn it on and we first put it on the patient, there's a beeping noise, and I like to kind of refer to it as when a lady goes to the doctor and gets her first ultrasound and you can hear the heartbeat. That's kind of what it sounds like to me. And so you can just use this down button here and turn it off. This is the patient cable here, and this is what attaches to the pulse ox and then to your patient. This red end here goes into your pulse ox, and it can only go one way, so you can't really mess it up. And it can't get pulled out. You actually have to use your gray tabs here to pull it out. This is the patient, what goes on the patient. It's what we call the probe. And I'll show you placement here in just a minute. But again, it can only go in one way. It will go in this end, and you'll just flip this thing up here. There's arrows on it. So there's arrows there and arrow there, and you just slide it in and close your clip. Okay, this cord over here is just the power cord, and it attaches to the back, and then you just plug it into your wall. Placement on a baby. We like to do the placement on the foot, and we always want to make sure too that whenever you open a new probe that you have this flashing light. If for some reason there's a defective probe, you're not going to have a light here. And then that way you know you have to get another one. But for placement, one part of the sensor needs to go on the top of the foot, and the other is close to the bottom as you can get it. Sometimes they're not going to line up exactly because different babies have different little fat feet. So some of them have fat, some of them have skinny. But at any rate, that's the placement that you want. Now we do want you to change placement about every 12 hours. So that would just mean to take it off and go to the other foot, or even to the other side of the foot. One side of the foot to the other side of the foot, or one foot to the other foot is totally fine. So about every 12 hours you want to change that, unless you're noticing that maybe your baby is got extra sensitive skin. You need to want to change that more frequently. Lastly, if you don't think that your pulse ox is working correctly, what you do is take your probe off your baby, put it on yourself, just on your finger here, and just wrap it around. If you've had, no medical conditions or anything like that, then your pulse ox should read normally, which normal pulse ox is 100, heart rate 60 to 100 for adults. And then you can see here that it's picking up. So that's normal for me, and should be normal for you. And that's just kind of how we test it to make sure that maybe there's something wrong with the baby, or maybe there's something wrong with the pulse ox. But if you know the pulse ox is working correctly, then something's wrong with the baby and you need to contact your pediatrician or doctor.